Hello everyone, my name is Humaira. Today, I'll be focusing on a very current healthcare concern in Canada, which is poor communication among nurses, especially during handover periods, which is also known as shifting periods. According to a recent news report from April 2025, miscommunication among healthcare workers is linked to nearly 1 in 4 hospital incidents that threaten patients' safety. That figure underscores how serious this issue is. Nurses play a key role in this communication chain. At shift changes, they pass vital information about patients' status, treatment changes, and potential complications. If this information is incomplete, vague, or delayed, the consequences can ripple across the entire care team and directly affect the patient. For example, imagine a nurse forgetting to report a patient's allergy to a new medications. If the next shift is unaware, the patient could receive a harmful drug, leading to a serious adverse reaction. Another example is when a nurse fails to mention a patient's recent change in vital signs. This could delay interventions and result in deterioration before the physician is even informed. This topic is important for nurses because it touches their core professional responsibilities, which is accountability, clear communication, and correct patient care. When communication fails, it can compromise how nurses carry out their roles, how they collaborate, and how safe they feel in their practice. It's important for other health professionals too. Physicians, therapists, pharmacists, and others rely on accurate, timely information from nursing staff. A breakdown in that flow affects teamwork, delays decision, and may lead to errors. For instance, if a physical therapist isn't aware of patients' fall risk due to poor handover, they might plan an unsafe exercise, putting the patient at risk. For patients, this concern matters because they expect care delivered in a coordinated, well-communicated manner. When nursing communication fails, it undermines trust, care, quality, and patient's experience. An example from the real world it could be if a patient receiving conflicting instructions about medications or follow-up care because different staff members were not properly informed. In short, improving nursing communication is not just a nice to have, it's a fundamental to safe, effective, professional healthcare in Canada today. By prioritizing clear handovers, structured communication tools, and teamwork, nurses can protect patients, support each other, and maintain professional standards.
Hi everyone, my name is Khatib Mohammed and I'll be presenting the news coverage that highlights how poor working relationships among nurses directly impact patient safety. According to U.S. News, poor communication among healthcare workers were responsible for 25% hospital safety incidents, and in 1 out of 10 cases, it was the sole cause of patient harm. These incidents included mismedication, delayed intervention, and preventable deaths. One example involved a patient who died after post-surgery bleeding went unreported, showing how a single lapse in communication can have life-threatening outcomes. Supporting this, Global News reported that burnout and toxic work environment worsen these communication failures. Nurses experiencing chronic stress or hostility are less likely to collaborate effectively. CNN Health added that stress and fatigue impair judgment and reduce empathy, which further increase the likelihood of clinical and ethical mistakes. These reports show that patient safety isn't only about technical skill, it's also about teamwork and psychological safety. Barriers such as fear of confrontation, habitual routines, poor documentation, emotional stress, and personal bias are all limits of a nurse's ability to think critically and communicate clearly. By applying the clinical judgment model, recognizing cues, analyzing, acting, and evaluating, nurses can identify early signs of conflict and prevent harm. Maintaining critical thinking, ethical reasoning, and supportive disposition, like curiosity, integrity, and open-mindedness, is essential for patient safety. By fostering clear communication, teamwork, and critical thinking, and professional integrity, nurses can prevent errors, help nurses ensure safer care in a stronger, more supportive healthcare environment.
Hi, I'm Amy, and I will be presenting supporting information on the topic of unhealthy interpersonal relationships among nurses with the peer-reviewed journal article. The study from this article examines how interpersonal conflict at work affects nurses' mental health and its broader effects on the healthcare system overall. They found that nurses who experience more conflict with fellow nurses, nurse managers, or physicians are more likely to develop depressive symptoms. Place conflict leads to heightened negative emotions and reduced sense of purpose and meaning in life, which intensify depressive symptoms. Conflict disrupts a nurse's connections, relationships, and team cohesion overall, and the resulting depression can make nurses more irritable or withdrawn, affecting teamwork and communication with colleagues further. Medically, depressive symptoms among nurses can lead to decreased quality of patient care due to emotional exhaustion and reduced empathy. Furthermore, decreased communication and strained relationships with coworkers can also lead to negative consequences on patient outcomes. Economically, unresolved conflict and poor mental health in nurses drive high turnover, absenteeism, and higher healthcare costs, putting extra strain on an already understaffed and struggling system. Politically, the findings underscore the need for a systematic change in policies that prioritize nurse well-being, including mental health programs, conflict management training, and safe staffing regulations.
Hello, I'm Sebastian Petropoulos, and today I'll be talking about a peer-reviewed article titled The Experiences of Organizational Silence Among Nurses. This study analyzed 12 qualitative papers from around the world to understand why nurses often choose to stay silent in the workplace, what emotions are behind that silence, and how it affects their health and patient care. The researchers found that organizational silence, when nurses withhold opinions or concerns, has major negative effects on nurses' mental health and job performance. Many nurses stay quiet because they fear punishment, conflict, or being ignored. Over time, this silence leads to emotional strain, guilt, and burnout, which lowers motivation and increases the risk of depression and turnover. Socially, silence weakens trust, communication, and teamwork among nurses. When people feel unsafe to speak up, collaboration breaks down and relationships suffer, leaving nurses feeling isolated and disconnected from their coworkers. From a medical perspective, silence can directly harm patient safety. When concerns or errors aren't reported, important information gets lost, which increases the risk of mistakes and reduces care quality. Emotional exhaustion, in addition, also lowers focus and empathy, making it harder for nurses to provide compassionate care. On an economic standpoint, burnout and silence tend to drive higher turnover and recruitment costs, which place even more pressure on understaffed hospitals. On the political side, the study calls for policy reforms that promote open communication, psychological safety, and mental health support in healthcare systems. The authors recommend leadership training, conflict resolution programs, and stronger support systems to encourage nurses to speak up.
Hello, everyone. My name is Humaira. For this section, I'll be answering the physiological approach through a social justice or advocacy lens in the news article that I have analyzed. The journalist emphasizes that gaps in nurse communication threaten patients' safety and places responsibilities on hospitals and healthcare organizations to enhance teamwork and provide proper support. This lens focuses on fairness, ensuring patients receive safe care, and nurses have a supportive work environment. I'll be discussing this approach through what we have learned in week 2 and week 3 content, which is highlighting the importance of professionalism, collaboration, and critical thinking in safe patient care. By framing the issue as a systematic concern rather than individual blame, it encourages proactive solution. However, there are some gaps. The article does not show the personal experiences of nurses dealing with heavy workloads or stressful shifts, which would reflect a phenomenological perspective. It also does not address organizational policies or staffing challenges, an element of critical social theory. Additionally, consistent with week 6 and week 7 content, the article overlooks diverse patient population, including indigenous and marginalized groups, whose care may be disproportionately affected by communication failures. To make the discussion more comprehensive, it would be helpful to include bedside nurses, patients, families, and other healthcare team members, especially those from diverse cultural backgrounds. In summary, using a social justice lens emphasizes the need for safer systems and better supports for nurses, but integrating other physiological perspectives would give a fuller understanding of the issue and its impact on everyone in the healthcare settings.
This is Saleha, and I will be discussing the cultural considerations within the healthcare context. Poor communication in the cultural context can cause exclusion, discrimination, and conflicts among staff in diverse nursing teams. Here, nurses need to recognize differentiating communication styles among their colleagues. Communication styles are learned behaviors which nurses can use to enhance collaboration and inclusivity. Developing cultural competence not only builds mutual understanding among nurses, but also helps nurses adapt to their patients' beliefs, identities, and values. Another thing that can hinder effective open communication and mutual understanding decision-making is when cultural safety is overlooked. It's important that nurses acknowledge privilege and power relations because if not addressed, it can reinforce the idea of power imbalances. This can create ignorance to systematic barriers such as racism, discrimination, and colonialism. As a result, nurses can fail to adopt anti-racist approaches to their practice when caring for patients. A lack of awareness can limit access to care and patients' health decisions being dismissed, leading to inequitable care. Nurses should aim to prioritize the needs of the person, whether that's a patient or a coworker, to create a safe environment where everyone feels empowered to speak up without the fear of discrimination. It's essential that nurses engage in self-reflection of biases and learning from others' experiences from time to time as a part of their practice. This is known as cultural humility. Nurses should be open to learning from patients and coworkers, admit when they don't know something, and value the person's perspective in their own culture to ensure ethical practice.
Hi, my name is Kelly, and I'll be expanding on the topics Amy discussed earlier in more detail about the possible nursing implications. Based on my new knowledge and insights about nursing as a profession, I feel that promoting a supportive and inclusive work environment is important because racism and microaggressions against nurses at work can damage trust and communication, even if they were unintentional or something subtle. Racist behaviors or comments can lead to nurses with a marginalized background feel excluded or disrespected, which can then lead to an increase in stress levels and a decrease in effective communication between nurses. A practical and professional response to this implication would be to establish clear behavior expectations for everybody equality in the workplace and provide a safe space where anybody can speak up without judgment. Secondly, addressing mental health is extremely important because we have learned that for nurses there is a clear relationship with emotional distress causing depressive symptoms. Therefore, in order to maintain an effective and resilient workplace, the mental health of nurses must be taken seriously. And to do so, there should be easy and accessible counseling services for nurses with leaders, regularly normalizing discussion about mental health struggles to eventually lower the stigma around this topic.